So if I were to get, so I see a lot of patients here in my clinic, but the number one thing that I get questions about are knee replacements, right? That they're super scared, or when they get the knee replacement, am I ever gonna be able to get back to where I was at before? And that depends, right? Where were you at before? That plays a factor too. Were you using a walker already before you even need replacement? Were you being able to jog and run and, be physically active with no limitations, only some discomfort to the knee before the knee replacement? All those things play factors, and that's why I always treat individuals accordingly. What was your independence? What was your prior level of function? Because your goal may be different than someone else's. Someone's goal that comes in may be just to get up and off the toilet independently with no issue. And someone else may be to be able to run a half marathon in a year. Those are the factors that you want to take in consideration. But the number one education that applies to everybody is make sure your nutrition is on lock too. I feel as physical therapists, we don't really educate patients enough on things they need to be doing other than physical therapy. Make sure you're staying hydrated, making sure that you're taking in some type of protein after you leave physical therapy. I don't care what your protein source is, just take in some type of protein. Because in order to recover properly, you want protein synthesis to occur and not have excessive muscle soreness. So when we get muscle soreness, that's from micro tears to the muscles. What helps micro tears to the muscles repair and recover? Amino acids to our bodies. What is amino acids? It's broken up from proteins. So that's why I always tell people, make sure that you take in anywhere from 20 to 25 or more grams of protein within a 2-hour window. It doesn't have to be exactly 2 hours, but research shows that protein synthesis occurs best when there's carbohydrates and proteins within a 2-hour window of the workout. So that's why I always tell people, it's not gonna just be physical therapy that helps you recover, not be so sore, not have so much pain, or heal faster. It's what you're doing at home too. So make sure you're eating properly, make sure you're staying hydrated, make sure that you're getting your blood work done, make sure that you don't have no deficits and nothing. Everything in a combination is what's gonna help you recover. So make sure you get all these things on lock before you get your knee replacement. So when you get your knee replacement, it's just gonna be a smooth sailing and your recovery is gonna be great.